This morning, I'm announcing 3 additional presumptive positive cases of COVID-19 have been identified in Manitoba. This brings the total number of cases to 7. That's including 4 confirmed cases and these 3 presumptive positive cases. Case 5 is a man in his 70s. Case 6 is a woman in her 70s, which appears to have been exposed to the virus during travel. Case 7 is a woman in her 50s. One of the cases is located in Winnipeg, and another has been identified to live in the Interlake region. Further information will be gathered on these as public health investigations are ongoing.
And as of today, our total case numbers are at 6. 4 are related to travel out of the total 6. 1 is a close household contact of one person who actually went to a large conference in Canada. So because all the cases are still travel-related or close household contacts, our risk in Saskatchewan doesn't really change from that perspective. But obviously when you have cases, and now they are throughout the province, north, in the central part of the province, in Saskatoon area, Regina area, obviously we need to become more aware of what we all need to do, which really is, and that is highlighted in my order on Friday, is that we absolutely need to self-isolate now once you come back after traveling internationally. So if you've been to the US, anywhere in the world, and come home, stay home for 2 weeks, don't go to school or work. If you've traveled to an international conference anywhere in Canada or another large group event, or it could have been a cultural event where other people from around the world came, monitor yourself very closely for 2 weeks. Don't go to school or work if you're symptomatic. That's what all these people have done, and that's how they've minimized any further contact. So I just want to clarify that at this point, with the number of cases we have and the fact that they're all travel-related, we really don't think that there's any reason to close schools anywhere in the province at this time. Obviously, we are in constant touch with local jurisdictions, including public health, medical health officers, school divisions. We have frequent discussions with them. And if there's a reason to close a school locally, that can happen, but there's no reason to do that right now. And similarly, if there were in the future any reasons to consider broader school closures as part of more community quarantine measures, that will be considered, but again, at this point, there is no reason to consider that.
So starting today, we ask owners of bars and discotheque, training centers, movie centers to close them. Regarding restaurant, we ask them to reduce the capacity at 50%, the number of clients that usually they can welcome. And what we're saying is that people must sit at every second table. So that is clear. Why do we do that? We do that because we think that right now we have to slow the increase in the number of people infected. So that's why we're asking for these additional measures. And we repeat to all people that you must always be at 1 meter at least of other people. So that is what we announced today.
This afternoon, I'm here to announce 4 presumptive cases. All these cases are connected to the first travel-related case. So I know this can be very disconcerting and very stressful to hear, but I am not surprised by this, and I expect that there will be more travel-related cases that result in a cluster of very close contacts or household members. So the cases are as follows. Male between 50 and 60 years of age, a female between 50 and 60 years of age, a male between 20 and 30 years of age, and a male between 20 and 30 years of age. So we're breaking down in gender and an age group. And the diagnostic testing confirmed the cases as presumptive. Additional testing to confirm the cases as a positive COVID-19 case will take place at the National Microbiology Laboratory in Winnipeg. So that is the same procedure for all the testing. We do all the testing at the George Dumont Hospital. We will announce the presumptive cases, and then those tests will go to NML for confirmatory testing. But when we announce a presumptive case, we're very, very confident that it will be confirmed. So active contact tracing is being conducted by regional public health officials.
We've had 3 cases in the last 24 hours reported from our lab, and we now have the capacity in the lab to be able to report presumptive cases tested here locally. They are all these positives are going to the national lab for confirmation. We have a 61-year-old woman who lives in Kings County who is traveling to Australia. A 50-year-old male who lives in HRM was traveling to the USA, and a male in their 30s traveling extensively throughout Europe. So all of these cases have had travel outside of the country, which would have been their source of exposure. None of the 3 cases are connected to each other. Extensive public health follow-up on all the cases and their close contacts began last night. As soon as we were notified of the cases, we were able to say that there are a small number of Nova Scotians who were in close contact with these individuals, and all those, but were fortunately a small number, all those individuals are now being asked to quarantine themselves for 14 days and monitor their symptoms carefully, and then call 811 if they develop symptoms suggestive of COVID. So the public health steps are well in place to manage these 3 cases.
The confirmed number of cases here in Alberta has risen by 17 in the last 24 hours to a total of 56. Of the 17 cases, 3 are in Edmonton and 14 in Calgary. Chief Medical Officer Dr. Hinshaw will follow with details on these cases. We believe we have reached an inflection point in the progression of this pandemic in Alberta. For at least some of the new cases over the weekend, public health officials have not confirmed a travel history or close contact with a traveler. This indicates community spread. However, follow-up investigations are continuing.
As the Premier noted, I have recommended that aggressive new public health measures be implemented across the province. Here in Alberta, we have confirmed 17 new cases of COVID-19 in the last 24 hours. This means that 56 cases have now been identified in our province. 2 of the individuals are receiving treatment in hospital and are in stable condition. The other 15 cases are self-isolating at home and are expected to make a full recovery. As always, health officials have taken swift action to isolate these individuals and any close contacts who might be at risk. However, there are several concerning elements about these new cases. Our investigation determined that 7 of these cases stem from a single gathering that took place in Calgary zone. This underlines the fact that gatherings can accelerate spread of the virus. In addition, at least 2 of the cases within the last 2 days appear to have been acquired from an unknown source. This means we are likely seeing community transmission in Alberta. Community transmission is when a person catches the virus from someone who stayed in the province and not from someone who recently traveled. Until now, all cases in Alberta had been travel-related or close contact with a returning traveler. These 2 cases mean that there are other cases in the community that we have not identified, increasing the likelihood that Albertans may be exposed within their communities.
The Emergency Management Committee of Cabinet met earlier today. In response to the escalating number of infections, Dr. Hinshaw and her team have recommended new measures on social distancing to contain the spread of the virus, and the government has accepted those recommendations. These include the immediate cancellation of all K-12 and post-secondary classes, as well as closure of licensed childcare and out-of-school care programs in Alberta.
Based on what we've seen over the last 2 days, it is clear to me that now is the time for additional action. We need to put in place more restrictions to help slow the virus and protect public health. That is why, effective immediately, the Emergency Management Cabinet Committee has approved my recommendation that students no longer attend classes in schools or post-secondary institutions until further notice. All regularly scheduled classes are cancelled, regardless of class size.